This is Dr. Sanjay Zodpey. I am the Vice President of Public Health Foundation of India and also the Director of Indian Institute of Public Health, Delhi. By training, I am a physician and subsequently trained in public health. When I was a medical student, I was always fascinated by issues related to the public health, and therefore I decided to opt for MD in community medicine as a part of postgraduate education. Then subsequently I also have a doctoral program in public health, and because I always believed that if we really wanted to look at the national development in a larger context, we need to address public health issues, and therefore I came into the public health. See, the public health is in true sense a multidisciplinary, and why we do say that, because we believe that there are multiple disciplines which contributes to the public health, because public health is a discovered discipline. It's in fact a fusion of several disciplines. And health is affected by several factors. It's not only the microorganisms, or we talk about the medical problems, but social issues, environmental issues, they all contribute, economic issues, they all contribute to the health. And we all know that there are several determinants which can be classified as social and economic factors which contributes to the health. And it's also important to understand that how they contribute in overall disease causation and how they contribute and increase the risk of several diseases. Take an example of, for that matter, non-communicable diseases. Several social determinants which contributes, even infectious diseases also for that matter, several social factors which contributes to the occurrence of infectious diseases. And therefore it's critical and important to understand that the causation pathways, that how they contribute to the occurrence of these diseases, and thereby understanding how do we prevent these conditions. So that's context of the social determinants that play a very important role in the disease pathways. I believe, for example, we say that social determinants. When we talk about determinants, we talk about factors. But generally, I believe that when we talk about the approach of social determinants of health, it's beyond those determinants and factors. We talk in terms of conditions, systems and processes, both in terms of socio-economic, social and economic, which influences the health. And if we take that approach, it's quite broader approach. It's not only restrictive of what are the social factors or economic factors, but we believe that in that context, social determinants are the drivers in advancing the agenda of public health. And those interventions are critical to understand, because in a programmatic way or in a policy, we say that all these factors are in the conditions and systems and processes which influences. And traditionally, we have seen the evolution of the social determinants of health. Therefore, I believe that, and I also believe that for the protecting the health of the people, it's critical that we respond to these social determinants of health. And therefore, if we look at the strengths are concerned, unless we address the challenges surrounding social determinants of health, we would not be able to assure the health of the people. That's the context. I would say that because for public health, and in that relationship you talk about the social determinants of health also, it requires a multi-sectorial approach. It requires a multi-layered approach towards the public health. It's, in true sense, it's a multi-pronged approach basically if you look at it. But unfortunately, because it's easy to say transdisciplinarity and interdisciplinarity, but somehow this intersectoral approach is not figured and is not reflected in the programs, for the reason that several ministries do not talk to each other, several sectors do not talk to each other. And if we really respond to the social determinants of health, we will have to ensure that there is a talk and there is a dialogue and there is a discourse between various disciplines that do happen. And even today, therefore, when we try to find a solution to a problem, we have a very focused thinking. We need to also have a very broad thinking surrounding those issues and those sectors. And therefore, what I would feel is that it requires a multi-pronged, multi-structured, multi-sectorial, multi-layered approach. Because even multi-layered also, moving from individuals to the communities and from communities to the national approach to the global approach.